Sometimes my mom lets me ride my bike to Mr. Johnson's house to play catch. I'm the best outfielder he knows. I think he used to be a baseball player or something a long time ago.
Can Mr. Johnson come up to play catch?
Honey, I'm sorry, but he's not really up to playing catch today.
I hope the doctors make them all better real soon.
Palliative care is basically bringing the same expertise that we bring to hospice patients to patients who aren't in hospice.
It can be given much earlier in the course of a serious illness or a potentially life-ending illness, but people can still be getting active treatment of their disease. They can even be getting treatment that might eventually cure their disease. Not all our patients are near the end of life by any means.
Heart disease and lung disease and liver disease are all things that can benefit from both hospice care or early on, before hospice is appropriate, to get palliative care involved.
They need help with their symptom management while they're pursuing other treatment. Nausea, difficulty breathing. We as a team hear more about those things partly because we just take more time with people. Hospice of Holland has the only program in West Michigan that has both inpatient and outpatient palliative care.
I'll see patients in the ICU, or I'll see patients on telemetry or on just a regular medical surge floor. But we'll see patients in nursing homes, we'll see patients in assisted living centers, in their own homes, and then we also do have an office setting where we like to see patients as well.
Hospice of Holland also has the only outpatient palliative care program that's multidisciplinary, with 2 board-certified physicians as well as hospice and palliative care certified nurses and social workers.
Another large part of what we do is be able to talk about big picture type things, goals of treatment, what is beneficial for me given what's going on with me, being able to sometimes have those difficult discussions with people. One of the things that we very much like to try to achieve is to have family members in harmony and in unison with what's happening. To be able to offer an opportunity to have everybody gather, to be able to talk about their concerns, to be able to talk about their fears. As a team, we'll have a discussion about patients, and we do this every other week. We sit down and we go through our patients, and we have a chance to discuss what we're doing for them.
The American Society of Clinical Oncology has now recommended palliative care at the time of diagnosis for all people with metastatic cancer and what they call a high symptom burden. All their patients, they should be getting palliative care.
People, I think, for a long time, hospice care was felt to be that's only for people who are in their very last days of life who have cancer. And I think people are starting to understand that that can really be a benefit that's available to them much earlier in the course of their disease and in much different illnesses.
We can't make their disease go away, but we can give them a good quality of life. They feel better.
If we get into a situation where the patient has really done very well, then we'll sometimes say it's time for us to disengage and to discharge the patient.
Maybe they'll need us at a different point in their journey, but if we can do crisis intervention and help them get better, we're happy to see that.